Our feet work hard, letting us do the things which are important to us, like exercising, going to work, walking the dog, shopping, and even keeping our homes clean. We often take our feet for granted, but taking care of your feet now can prevent lots of problems in the future. It's not until our feet start hurting us or preventing us from doing what we need and like to do that we realise we should be looking after them more. Now is the perfect time to start. Wash your feet every day in the shower, bath, or using a bowl. Make sure you wash well between your toes and make sure you dry well between your toes too. This will stop them becoming damp and encouraging infections such as athlete's foot. Apply a moisturising cream to your feet regularly. Try not to put a moisturising cream between your toes, as it can make this area too soggy. You may need to do this every day if your skin is quite dry. It's best to use a cream specifically designed for your feet, as these are usually more effective. Lots of foot creams contain an ingredient called urea. This is a good type of cream, especially for hard skin around the heels. Check your feet while you're doing this. Knowing what's normal for you will help you spot anything unusual quickly. When you need to cut your toenails, find a comfortable position. You might find it easier to sit with your foot up on a small stool in front of you. Remember that if it's difficult for you, you don't have to do them all in one go. Cut one or two and come back to the rest another time. Cut your toenails straight across. Don't cut down the sides, as this may cause ingrowing toenails. Use an emery board or a nail file to smooth off sharp corners. If your nails are thick, use a file over the top of the nail to reduce the thickness before cutting them. You can buy different types of nail cutters or nail nippers from supermarkets, pharmacies, and on the internet. Find the style that suits you best. Lots of people find that filing their toenails regularly helps to keep on top of things. File any rough or hard skin gently with an emery board or a foot file. Do this little and often when your feet are dry. Try not to use a metal grater type of file, as these can be too harsh. Remember to use a foot cream regularly on these areas. Some people find it useful to keep all their foot care equipment together as a handy foot care kit, which they can keep just for themselves. Wearing the right footwear is an important part of keeping your feet in good shape. Your shoe should not be too narrow towards the toes, and ideally should have a fastening, such as a buckle, strap, or lace, to stop your foot moving when you walk. Remember that shoes which are too big can cause as many problems as shoes which are too small. Try to wear shoes with a cushioned sole and be mindful of any seams inside which could rub against your skin. Our feet can sweat more when we wear socks made of man-made materials such as nylon or polyester. Try to wear socks which are made of natural materials such as cotton, wool or bamboo. Lots of shops sell socks with loose elastic that don't cut into swollen ankles. If you suffer with cold feet, wear 2 layers of thinner socks rather than one thick pair. There are other ways to help keep our feet healthy. Smoking can cause blood vessels in our legs to become narrow, making it more difficult for the blood to get down to our feet. This means if we have a cut or a sore on our foot, it might take longer to heal. Being overweight can cause foot and ankle problems because all our weight is carried through our feet. Try to keep a healthy weight by eating a balanced diet and taking regular exercise. Podiatrists or chiropodists are foot health specialists. If you have a problem which doesn't improve as you would expect with self-care, you should contact a healthcare professional for advice. This may be your GP, pharmacist, NHS podiatry service, or a private podiatrist. Please make sure your podiatrist is registered with the Health and Care Professions Council and look out for the letters HCPC after their name.